Now, this is a little tougher one, but I would recommend it to any patient who's having a hard time getting out of the chair. When you have disc problems or major low back problems, chronic pain in the low back, it can be hard just to get up. Okay, so a lot of patients that come into my office have told me, Doc, if I'm sitting too long, I'm like an old person, getting out of the chair or off the couch, and I'm cramping up. And it's pretty typical stuff. Same with driving. So similar to that, when you are kind of loosened up and you're moving, I want you to try to sit down into the couch. Now, you might fall in like I just did. You might just fall into the couch and then you kind of rock back up. But I want you to try to, over time, sit almost down and then get back up. Again, sit almost down and get back up. Man, it'll work your quads and your legs, but it's really going to help you have some more strength instead of just falling into things, okay? So again, at first, you may just sit down and go, oh, I'm done. Get back up, get up one more time, and then get back in the seated position. Over time, if you could do 15 to 20 of those, you're going to get so much stronger. You'll be able to get off the couch and hopefully stay off the couch. But we want you on the couch when you want to be on the couch, but we don't want chronic pain to control your destiny and control your life. So you can end chronic pain, use some of these stretches and strengthening for your whole spine, and you too can have a life worth living.